Okay, it is 4:03. We'll open the meeting of the Board of Health, January 25th, 2024, for the purpose of interview of one applicant for the Board of Health clerk position. This position was posted, I think, in October or November, and we had one applicant. And so just gonna take a second to look at the resume and pull up the job description too. Okay, so Sue, why do you want to work at, for the Board of Health as the clerk?
I guess I was looking for something to help the town out with. I've been living here forever, I was on the fire line for probably longer than I should have been. But I've been looking and I thought this would be an easy fit for me. Since I work with nurses, doctors and the healthcare every day.
Mhm. I'm sorry. Your resume is much more advanced than the job description calls for.
Yes.
So what do you say to that?
That's fine. Like I said, I was just looking for something to help the town with extra hours,
Okay.
so. It is very extensive, but it's the only resume I have,
Yep.
so
Oh, yeah,
I
no, it's
figured,
good to see your accomplishments for sure.
I know it's only a certain amount of hours, but and I told you before, and I'm not opposed to working more hours or helping with anything that you need help with.
Yep.
I have extensive event planning, extensive work with nurses and nursing students, so do
So,
whatever you need.
so the two previous clerks have really focused on is like doing the transfers, doing the accounts payable, helping with communication with Lester, the Public Health Coalition, who does all of our inspections, occasionally with Phil Ledger, OCAM's longtime septic inspector. They've helped respond to emails. They scanned in like this stuff to what was a OneDrive account that we were paying for separately. Now the town now has Office 365.
So easy, yeah.
And we have SharePoint, so you can access it from your phone, which was the reason why we went there, is because we started uploading things in 2020 and because it was the beginning of COVID and we didn't have time to be running back and forth up here to see if there were plans. So as we started getting applications, we were just scanning them. Somebody needed a copy of something, I would just go on my phone and could email it from there. And so that's really what we want to continue to be electronic. And that what hasn't happened is we've not started going through our files. And that really is the next step. So the job could be done in as little as an hour a week, probably, if all we do is the basics. But we've limited ourselves because of time constraints, and the town in the previous town meeting approved about 2.5 hours a week on average, for our budget. And then in the special town meeting on Monday, fully funded the Board of Health's original request, that for whatever reason, the Board of Selectmen did not put forward, to fund it for about 5 hours a week. So, as of Monday, we now have funding for an average of 5 hours a week.
Okay.
So it could be between 1 and 5 hours. If it's a busy season, it could be more than that, but we just have to obviously keep track of not going over at the end of the year.
Sure.
So if the work is as little as 1 hour a week, are you gonna be bored with that? If it's,
No, because to me, this is just an extra helping out. It's not,
okay, you're not relying on it to.
no.
I don't think
So,
anyone can
I'll-
rely on 1 hour a week, Erin.
No, and if it is 1 hour a week, just pay me every 2 months or whatever. It's not worth the printing of
No.
a check or
Yeah,
hopefully it's direct deposit now. but-
yeah, you have the option of direct deposit, and the town is going with online timesheets through Harper's.
State of the art.
Jeez.
So, yeah, so we're getting there. So, any question?
I was just gonna add, I think you already hit on it, like sometimes we get requests for like the septic plans, and I think you did state that would be another role.
Yep, so,
task.
yeah, if you
Those
were.
are easy though, we should have them on record.
Yeah, the septic plans, we don't always have scanned. As they come in, we've tried to do like scans using, a scan app on my phone or.
Yeah, you can take a picture,
Yeah.
yeah.
But a lot of the plans are still in folders. And so that's where if we would love to have a half an hour scheduled office hour a week where we could say Wednesdays or whatever. And if it changes, all we do is post it on Facebook and say, the office hour this week will be Thursday.
Mm.
So we've not been able to tie either of the two previous clerks down. But that'd be ideal if we could always have that. That way, people knew I need a septic plan, realtors
Yeah.
want a septic plan.
Might actually save time,
Mhm.
and you're right down the road too, so that's
Yeah,
convenient.
Mondays and Fridays I work at home.
Okay.
So if you say every Monday at noon or every Monday at 5 or like I worked at home today, I can work my schedule around in my other meetings and things around.
Yeah.
If you wanna say every Monday at this time or every Friday at this time, just so people get a
I
consistency.
think Mondays would be
That's
ideal.
I think the town clerk is here on Mondays.
5 o'clock.
Yeah, I mean, I personally don't care as long as it's advertised and we use the website and we use Facebook to if there's any changes to it, communicate with the people so that they're not driving up here and
Sure.
so checking, I mean, email, I think we all have it on our phone now. But checking the email periodically, but know that there's no expectation if to be working when you're not getting paid. So just kind of be aware that you should have boundaries and don't feel like you need to reply to an email that comes in at 10 o'clock at night because that's work time. We're fantastic when it compares to other towns with responsiveness. But there can be some boundaries.
Yeah.
I guess the only other addition I had would be, she would be present for our regular
Yes.
monthly meetings, which is usually the third Wednesday of every month. Right?
Sure, yeah, if I have it ahead of time, I can put it in my schedule and make sure I leave the city in plenty of time to get here. Is that like minutes?
Yes, yep.
Absolutely.
And I mean, we have the Zoom, we're gonna do Zoom in all of our meetings. But which allows the option of a transcript and all of that. So there's features to it that could potentially make it easier. So, but it's also helping to prepare what I was trying to get done today. So copies of all of the payments I've received, copies of the payments that have gone out, so that's ready for this meeting. Helping to do the agenda. We would like this person to do the agenda, working with me, and the members email you to say, hey, I'd like this on the agenda. You can email everybody, say, hey, I'm working on the agenda. The town now makes the website the primary location of the posting. So we're not tied to 48 hours and 1 minute before posting it on this board. So I made multiple updates to this agenda from when I posted it last week, but I did it all from my phone. And so we meet the 48-hour requirement for public notice, so.
I'm really impressed. It's great. So I can bring my laptop and do all the minutes and
Yep.
all of that on my
You don't,
laptop?
nope, you don't need to bring your laptop
We
because
have one for you?
we bought,
Oh,
we have actual devices and,
okay.
Mine is here, by the way, so if we need to use that one, if we
oh,
need to get.
we've got more than we need,
Okay,
yeah.
yeah.
I think we have 5.
Oh, wow.
We have
Okay.
iPads, and laptops,
Okay.
so, yeah,
I do
so
everything electronic.
so well,
I.
then you're
yeah.
gonna you would fit in well.
Right.
Because that is what we're trying to do is electronic.
I think to we have double stacks, maybe 3 stacks of all property addresses and files. And I think with your event coordinating skills and experience, that would be something I think we should put really on an event and to-do
Yeah,
list soon.
yeah.
I
Like-
mean, not all on Sue, but find kids that need community service or
Oh, yeah.
something, because that would free up so much space.
We don't need.
And it's not even functional. You go in there and you find 60 New Braintree, you're not 60 is across the
Yeah.
street from me. And it takes forever to find it.
We have
you
4
know?
filing cabinets, and quite honestly, I think we could get away with 2.
Oh, yeah,
I
it-
did that for the fire.
But
Best thing ever.
yeah.
But even like helping, we talked about doing, we would like to do CPR training for the community.
Mhm.
We purchased CPR mannequins, I think 6 sets or 6 mannequins. We are certified to do it. And so to do like even babysitter classes, and we do the townwide cleanup in June, that's already scheduled. So to help with some of the organization to that. You know, I've been we've been late to submit our annual report, which was due, I think, December 1st, and I'm working on it. But this would be something
Sure.
that really we would hope that the clerk would assist with. As communications come, there's on the SharePoint site, there's meeting packets so that stuff could be put there in advance of the meeting. We don't necessarily have to print everything.
Does everyone have a laptop? So
They
I had a
do,
folder like in,
but everybody has access to SharePoint.
right, so you put everything, because, well, I use Teams a lot
Everybody
for
has
my
Teams
meetings,
as
and
well.
I put everything in a folder, and instead of emailing it, or they go right to my folder. And
That's
where-
exactly what the expectation is here,
Okay.
is that we have the folders.
I just had one today, and they went in and looked at the agenda, that I did the minutes from last time, and all the course documents.
So I'll show you, this is the SharePoint that all town employees have. Why is it not showing? There we go. So this is, all town employees have access to this, and then, so if we go to Board of Health, right now, it's just the 3 of us that have access to this. And then
Yeah.
these are all of the files, so everything from December or January of 2020, we've been putting in here. So all of the streets, all of the permits, all of the septic things, applications are all in here. Yeah, where's this? Board of Health files. So yeah, everything is in here for the Board of Health.
Good, okay,
Um,
that's great.
I thought I had something, advance of meeting packets, there we go. So I had done this for December. I put in copies of the minutes we had to approve, the budget that we have to decide at our meeting in 15 minutes. And then the letter about the budget that was on the agenda. So basically, we would create a new folder for today's meeting, for the next meeting, and everything would just be uploaded in there. And I had Ani sent me December's minutes that once we approve those, we'll upload those to the website and upload them to the SharePoint.
Oh, that's great.
So we are, my guess is we are probably the most advanced of all of the departments, boards. But it's been as a necessity. So. Ani, any questions?
Nope.
Okay. I do not know what so the town participated in a salary study in 2019, 2020. So as it stands right now, even though the regulations, the law allows boards of health to appoint their own people. OCAM has a bylaw that says that the Board of Selectmen appoint the people.
Right.
So the Board of Health will make a recommendation of who we would like appointed. Board of Selectmen will vote on that at their next meeting. And then they're responsible for setting the pay rate. And I honestly don't know what it was. It was between $18.50 and like $19. And because I'm on that board, I really can't tell you what I think. So that's what it was set at for the previous person. So I think when it gets presented to the Board of Selectmen, I think there's an opportunity for the Board of Selectmen to negotiate what the rate is.
Okay,
So,
makes sense.
what questions do you have for us?
I'm not sure I have any. Covered pretty much everything. I mean, everything I already know
Yep.
and can do, and I assume I get all the training and all the
Yeah, we have
all of that. So.
Ani created a checklist. What's your comfort level, if and then provided education on comfortable in doing this. So there's a whole list for onboarding. Most of it would probably be with me as far as like, hey, I've got all of these invoices, let's do this one together. And then once you're up and running, it'll be yours.
Yeah, it's been a few years since I've
Yeah.
done anything, so
Yeah.
I'm sure things have changed.
Yeah.
Do you think Kylie would come to train?
I
Get a few
I
hours?
bet she would, but I don't know that because she's no longer in the system.
Oh, why did they take her out so quick?
Yeah,
Mm.
well, because she she had an effective date of resignation.
That's too bad.
But we could always ask Holly
Oh.
if she would volunteer.
Yeah.
So.
Yeah.
But we do have this relationship with Lester. There is potentially an opportunity to attend some of those meetings. There's actually a meeting next Thursday, I think, with the regional, all of the boards of health in that coalition to talk about it, because they got like $500,000 to provide services to all these towns.
Wow.
I mean, OCAM had a budget of $300 for its Board of Health before COVID.
That's crazy.
So, So, and so there's so much more that group could be doing. I just got a complaint today about a hoarding situation. We now have social services through the Public Health Coalition that could help. Where prior to the coalition, we got nothing.
Are we gonna review the latest hoarding in our regular meeting coming up?
It's not on the agenda, but it is a correspondence, so yeah, probably. Because it just came in today. So there's opportunity to be involved at that regional level with some planning. The senior center, we're trying to help them. We met with them in November, December, talking about what the Board of Health does. They're having a health fair coming up on February 14th. Diana offered to do an hour. I offered to do an hour just to be present. So yeah. Okay.
So what's the timeline?
So the board is going to. Oh, good. The board is going to take it up at its meeting in 6 minutes about who the recommendation is going to be.
Oh, the Board of Health?
Yeah, the Board of Health.
Oh, you're meeting tonight?
Yes,
Yeah,
yep.
it's Thursday.
And then the next selectmen's meeting isn't until February, the first Monday in February.
Oh, right. Okay.
So that would be the earliest, the Board of Health, the person could be appointed would be February 5th. And then potentially could start, anytime after that.
Okay, so you'll let me know if I need to be there on the
Yes,
5th?
yep,
Or?
yep.
I've been watching them though, it's pretty,
A lot of people have.
it depends on, well, now I'm working at home, but it would depend on what time I come through, like,
Yeah.
So I usually will watch them.
And do you know the highest viewing is actually on cell phones? It counts like the difference between cell phones and laptops, and I was very surprised by that.
Yeah, it's very convenient, because you can listen on your way home, or I've missed a couple, but I've gone back and watched, because I like to.
Yeah.
So,
And all of our Board of Health meetings are on there since September.
it's great, there's a lot of great progress.
Okay, well, if nobody else has anything, I would move we end the meeting of the interviews.
Second.
Okay, all in favor?
Aye.
Aye.
Aye, sorry, I couldn't unmute.
Okay, so I'm gonna end this meeting, and at 4:30 we'll begin the January Board of Health meeting.
Very good.
Okay?
Thank you, Sue.